Hello and welcome back to my channel. So before starting the vlog for today, I would like to request those who are watching this video right now, please do subscribe to the channel and also press the bell icon right there so that you get notified every time I put a new vlog on my channel. So as you have already seen from the thumbnail, the topic of discussion for today is dengue fever. So the first question which comes in our mind when we hear about dengue fever is that what it is and how it is caused. So it is an illness due to the infection with a virus of the family called as Flaviviridae. There are 4 dengue viruses which comes under this family, that are DENV 1 to DENV 4. Here I would like to tell you that DEN stands for dengue and V stands for virus. And these 4 viruses are a single-stranded RNA virus, and they are more common in the areas of the tropical and subtropical regions. The second question which might strike our mind is that how these viruses get transmitted in our body. So these viruses get transmitted through the help of Aedes mosquito. Aedes here is a specific species of mosquitoes which help in the transference of the dengue virus. 2 types of mosquitoes that we will learn here. They are Aedes aegypti and Aedes albopictus. Aedes aegypti is the one which causes the yellow fever, and Aedes albopictus plays a very rare role in the dengue fever, but still we consider it. And there are 2 major mosquitoes like Aedes aegypti and Aedes albopictus that we have discussed. Now, firstly we will write it down properly, point by point, so that we can learn it. So here you can see that I have written it point by point. So these points we have discussed already. Now, one thing that we should know is that these 2 mosquitoes feed the nervous blood, means they used to feed, they are the nervous feeder, and they feed on the human blood, and they need more than 1 feed to complete their gonadotropic life cycle. That is also a very important point that we should note down right now. So here I have written the points that they are the nervous feeder, they are the human blood feeders, and they need more than 1 feed to complete their gonadotropic life cycle. So now we will discuss about the pathophysiology. So here I have made a diagram to make you understand easily that how these viruses go inside the human body and they reproduce, and how our body shows the immune response towards them. So here we will discuss about the pathogenesis. So here you can see I have drawn, this is a person who has been affected with this virus. Suppose this is the mosquito and this is the proboscis of the mosquito is being inserted in the epidermis. This is the epidermis. So the virus particles has entered through the skin blood vessels, and this is pseudodermis, and is being taken up by the antigen presenting cells. These antigen presenting cells will take up the virus and will replicate it. So they will the virus particles will get replicated here and gets matured, and they will be transferred through the lymphatic blood vessels in the lymph nodes. And these antigen presenting cells get matured as they have been replicated here. So these matured antigen presenting cells, when comes in contact with the T cells, as they secrete the interferons, the T cells come and bind with it and get activated, and they start secreting the pro-inflammatory molecules. The pro-inflammatory molecules are TNF alpha and IL-6, IL-8. These pro-inflammatory molecules will act as a defense mechanism against the virus, and they will kill the virus. Okay. Also, they will act as a defense mechanism, but also they will decrease the plasma level of the blood. So here I have made a flow chart. Suppose the virus goes in the blood and they will damage the capillaries, okay, and they will increase the permeability of the capillary. Because of that, the plasma will come out, and still the platelets will remain inside, but the fluid level will decrease in the blood, and because of that there will be increase of the hemoglobin, that we call it as, there will be an increase in the hematocrit value, and because of that there will be the increase in the viscosity of the blood, and the blood will become thicker. Okay, because of that there will be an increase in the pulse rate, and there will be a decrease in the BP, the blood pressure. Okay, and that is called as dengue shock syndrome. Okay, so the plasma leakage. The plasma leakage is a process in which the protein bridge fluid component of the blood leaks from the blood vessels in the surrounding tissue. Okay, as we have seen already how our body shows the defense mechanism, now we will discuss about the various phases of the disease in terms of its sign and symptoms, and the incubation period as well. So here I have written down the incubation period, that is about 3 to 14 days, and the various sign and symptoms, which the dengue can be asymptomatic also, and it can be life threatening as well. So there are 3 phases, that are the febrile phase, the critical phase, and the recovery phase. The febrile phase lasts for about 4 to 7 days, as I have written here, and the common sign and symptoms that we will see in this phase are fever, headache, retroorbital pain, that is basically in the eye region, and myalgiasis, which is the muscle pain, the arthralgia, which is the joint pain, abdominal pain, nausea and vomiting. The critical phase is actually the phase which occurs in a patient which are having the secondary infection. If someone has the primary infection and within the 18 months time gap they get the secondary infection, these people have this phase called as critical phase, and they will also have melena, that is the black stool, and menorrhagia. Then the recovery phase, in the recovery phase we will see that there will be a chronic fatigue in the patient, and there will be the resolution of a vascular permeability. The permeability which we have discussed earlier in the pathogenesis, that permeability will be resolved in this phase. Basically it will be the resolution of the vascular permeability, मतलब कि वो ठीक हो जाएगा, ठीक है, कुछ ठीक होने की कगार पे रहेगा, हेमोरेजिक रहेगा person, and there will be the vital sign will be the stabilize, यानी कि the patient will be stabilized, and but still there will be the maculopapular rashes, which I have not yes I have written here, that the maculopapular rashes is also seen in the febrile phase. That particular rashes will also recover that be seen in the recovery phase also. Okay, these rashes in the febrile phase are seen 50% cases में, ये आपका देखा जाता है, ठीक है. In the febrile phase we can also add some points like there will be respiratory problems such as cough, nasal congestions can also be seen, and also in the febrile phase there will be the decrease of WBC count also, and what else, that's it. Now we will discuss about the diagnosis. Here I have written the diagnosis. Diagnosis is the
So here I have written the diagnosis. Serology, which is the anti-dengue IgM. In this we used to test the antibody IgM, and the treatments are like cold water, paracetamol. Cold water is given, paracetamol, and ringer lactate solution, as there is a lot of plasma loss in the dengue fever. We will try to recover it by giving as much as fluid we can give to the patient, but these are the basic treatments, and there are many more things which are given as per the treatment. And I think that's it for the vlog. Hope you guys liked it. If you did, please give it a thumbs up, and like, share, comment, and do subscribe my channel. Thank you so much.